Hi, everyone. It's good to see all of you here, but I can't actually see you, of course. I feel you in presence. Anybody who doesn't know me, I'm Molly Tennant. I'm the Executive Director of the Residential Assisted Living National Association. That's a big word to say. We are going to be sharing some information about Eldermark Senior Housing Software today. And we have Greg Bertignoli, and he is a partner at Eldermark. And he's going to share with us all of the information he can about their new small provider senior care management software. So please welcome Greg. And if any of you have questions, they're going to be typed in over on the right-hand side under the questions tab. Thanks.
Thanks, Molly. I'm glad you guys can't see me because I don't look as good as Molly. And I'm up, we're based out of Minneapolis. My name is Greg Bertignoli. I've been with Eldermark Software for, I don't know, going on 12 years now. We've been one of the oldest electronic health records in senior housing softwares. So we're a little unique. We've been around almost 30 years. We're really the only one that was built only for senior housing. We're based out of Minneapolis, Minnesota, but we have communities in all states. We have about 2,000 clients. Like I said, we've been here close to 20 years. We have about 18 modules that all talk to each other, but I'm going to talk to you tonight about something that's a little different. We just kind of launched the program because we've spent, 30 years almost building this great assisted living program, senior housing with 18 modules that are all integrated together. But we thought, the small providers always are reaching out to us and they want something. And we thought, hey, let's take our kind of world-class enterprise system, customize it, put it kind of, I call it like set up in a box where we're taking our 5 or 6 core main modules, put it together and offer it to the small providers because they really don't have the big technology that's available to them. So obviously we're all 50 states and in Canada, HIPAA compliant, but we kind of put together a big software system that's confusing and takes a ton of time to train and get acclimated to into bite-sized module pieces here. So I'll talk kind of high level on each module. These kind of demos are difficult for me. I'm used to having someone blast me with questions, so I'll try to keep on task here. The main modules, we have a great CRM. A CRM tracks the leads, prospects, inquiries, waiting list, basically a holding tank before someone goes into our electronic health record. But from our CRM, a world-class CRM, it's all web-based that you can use on your phone or any device, but that pushes all the information into our clinical platform. And I'll show you, the next screen shows how all these dots connect. So I'm just going to go super high level so you see them a few times, but our electronic health record, we call Service Minder. Full-blown qualified electronic health record. Every basically piece of information that you could want is able to go into it and go out into different reports. And keep in mind, this is all like a big buffet for you. Not everyone uses all of our modules. With our small business provider solution here, we kind of took the best modules, pre-configured them so you don't have to do a lot of thought process in the setup part, took best practices from all 50 states and kind of built them in there for you, so they're kind of ready out of a box. Along with our electronic health record, we have baked in there our EMAR, which is electronic medication administration record. We interface with almost every pharmacy in the whole United States, so it's great. So the pharmacy kind of doesn't change anything you do. It gets originated from the pharmacy, goes in the system, gets sent over to your community. You accept the med onto the MAR, pass it. So it's a great system to be much more efficient, faster, safer. For our EMAR. Risk management is built into the system too, so instead of having paper reports that are probably sitting on the corner of everyone's desk, we actually have risk management reports that all the information goes into a database, so now you can drive into that, do kind of root cause analysis and get information from it. And what's nice too is you'll see later we have alerting mechanisms built into the system where if you have a new incident or accident, whoever you want can get an email, a sentinel event, a different group of people can get an email, and if most importantly at the end, if the things have been done correctly, or if you're missing notifications, signatures, vitals, anything, it'll send you another email saying, hey, you need to check in and finish this risk management report. So risk management is really great, and that comes along in the package. Our point of care is kind of an add-on where if you do want to use tablets or mobile devices, you can take the assessment in the clinical piece, push out the schedules, create the service schedules for all the cares, and push that out to our point of care module. So now you're going in and you're tracking just charting instead of on a paper task list, charting on an iPhone or an iTouch or a tablet. Another nice thing about that too is our whole system can go online or offline. Which is very nice. If you don't have great connectivity in your community or house or go between different places, the whole thing can, or do an assessment at their house. You can do assessments, chart services into the EMAR offline or online, which is great. And one other thing that comes along if we're using those point of care devices and EMAR is our Wisdom to Act, which is our early intervention observation tool. So if anyone sees a change of weight, intake, skin condition, anything in a resident and wants to present that or send it out to the nursing team so they can interact early on that, they can touch on the point of care device or an EMAR and alert a nurse in advance. So it's great. And then most importantly, the whole thing is we have these world-class web-based dashboards that all these modules port all this information real-time live out to the dashboard. So you have great KPIs, metrics. It can track all this information anywhere, anytime. A couple optional add-ons, and there is a whole bunch of other optional add-ons for our enterprise system, but for the small business kind of set up in a box program. We also have our e-signature where they can sign their care plans electronically and other documents, and those all get stored chronologically in the electronic health record. Our cloud storage, which you can attach anything you want. It's like a HIPAA compliant Dropbox, and use that inside our electronic health record. And our Notify is our nurse call and communication, which I want to talk later about that because I think that is probably the hottest topic. I was talking to Molly for a couple of minutes before we got started, and the hottest thing right now is having the communication between the caregivers, the resident, and engaging their family too. And we have an app that can do all those, and you can track it and be controlled. It's easier than something like a big GoToMeeting, Skype or Zoom or something like this. You actually have control of everything if you're using our communication. And one optional menu, other thing is our billing and financial. We have a full-blown billing system that obviously when you create your care plans and track your services, it all goes into billing, does a month-end batch and can do your billing and financials, and that would be an additional one. So here's my favorite screen. If I only had you guys for 5 minutes, and I probably should keep an eye on my time because I'm used to other people interacting with me, so I don't know how long it should take, about a half hour. But it's kind of our connectivity here from start to finish. So this is kind of the workflow that we built into the system over 30 years of kind of connecting all the dots. There's usually most people have disparate systems. They have a CRM, they have their clinical piece, and then they have financials, and usually people working with different and smaller providers. A person could be wearing all the hats. It could be the janitor and the cook too. So, but usually all these things don't talk to each other. And our whole goal here is to have all of our systems talk to each other. So you have our prospecting, which is our CRM. It takes all the name, information, demographics, as much stuff as you can take, and pushes that into the input. The whole goal of this is to have input of a resident not take 8 to 10 hours, which is traditionally does, is get that down to 1 to 2 hours using technology and free up some of that clinical time. So when all the information that's in our CRM gets pushed into the electronic health record, from there you can take your assessment. We have all our assessments built into it. It can tee up all the ADLs. It creates all the schedules, the care plans, and everything is all tied to each other. Those can be electronically signed. Obviously, EMARS is built into the electronic health record, and EMARS is really easy. Everything in our system, we've been around 30 years, has to be user-friendly. EMAR, you basically touch on a picture of the resident, all their meds pop up. You can either attempt to give it, not give it, and have to chart why, or give it, and it'll put your initials down on when you gave it. It's just like paper, but electronically. And the best part is obviously the pharmacy is doing the heavy lifting. It's either being e-prescribed or faxed to the pharmacy. They're putting it into the system. They're pushing it over to you. You're looking at to make sure it's the right drug, dose, time, route, pertinent information. If you need to set up any bodily functions or vitals, you can record items, and you push a little red button and it makes it onto your MAR. So all you're doing is accepting the meds into your MAR. The risk management, like I said, comes along in both clinical and EMAR. There's hot links to it. The point of care is if you're using our handheld device, obviously you can. I do have one slide way deep in the slideshow that shows the old paper. You could do it daily, weekly, or monthly checkoff sheets, but the whole goal of our system is to alleviate paper. No one wants to have all the paper, and all these modules are connected to each other. So if you change anything vertically and horizontally, you change it one spot and it goes and changes the care plan, the service plan, the face sheet, their Cardex, everything changes dynamically within the system. Wisdom to Act is that early intervention observation tool that I talked to you about, where you could notate if someone had a change of condition and wanted someone to look at them as fast as possible. And then all this goes into billing, whereas while you're charting care, it's going to go say, hey, is that part of their package level of care? I don't know. We do have different models where if you do want to set up points, levels of care, package, minutes, we have different ways to configure the back end. And then to track all this, you have our world-class dashboards where you can log on and see all these things happening live, real time. So I know it was a lot. We can stop now. No, I'm just kidding. I have a lot more to go through. I'll show you screenshots of all that in a typical demo, and I guess that's the next step for whoever raises their hand later on that wants to see a deeper dive demo. We have reps, a couple of reps I think on this call possibly that I can go through and show you in a little more deeper dive on how everything looks. But our setup in a box is great. We take our best setup for our CRM, which you can still customize a lot of this, our master assessment template, to kind of develop everything the best way that we've done over 30 years, over a couple thousand communities in all 50 states. We've kind of taken best practices and built them into the system. So when you set up, there's not as much customization and setup that we typically have to do on the start. So with that being said, it's about 1/5 of the cost, and startup cost is our typical typical system. When we go in the implementation, there's a lot of setup. We go in, we set up all these with kind of pre-setup stuff, but some of the stuff we still really let you customize, like your face sheet, Cardex, how you want your marks, sheets to print out, position order sheets. There's a lot of stuff you can do too. We also back up everything every night on a drive on your side. So you get to pick a location where we take the face sheets, Cardex, MARS, and everything and back it up on a drive or location on your side. A lot of other setup stuff that we do here. Here's where we back up or email the backup each night, whatever time you want. There's a huge security template on all the 5 to 8 modules, or however many you want. We set up security groups, and you can click who has access to what modules and what permissions, and you can have different levels, all the way down to field level. We can even pick fields that we're not going to let people manipulate, but it's security templates where you put in their roles and give them access to those modules, or you can give them additional access or take access away from them too. Obviously, very safe and set up so we can track kind of Big Brother, and we can tell who's been everywhere into the system. The CRM is just an easy workflow. We kind of took best practices of all the different places and went in here, and any time you enter a new lead, you can enter in a new communication, set up a tour, visit, put in as much demographic information. It's a great spot to have waiting lists by units and different communities. You can have drop downs and also communicate with people on that waiting list. So we have kind of set up the discovery, tour, retour, lease signing, and move in, but you can customize to what you want your different sales stages. It's really nice because it tracks all your sales pipeline, your communications, contracts, all your inquiries, where your business comes from, your referral sources, shows you. And then on the CRM side, in those different stages where your leads are, you have discovery, tour, retour, lease signing, move in. You can drag and drop these people as they move into different categories and different sales stages. So it's really nice. The CRM has tons of reports, all kinds of KPIs for move-ins, move-outs, headcounts, occupancy, vacant units. You can see all this anytime from any device. These are all coded in React, which is Facebook's open source code. So it's mobile enabled. So if you squish these up, or if you're on your iPhone, you'll just see one thing. If you're on a big 24-inch monitor, you'll see more, but everything just looks great all on the top. Obviously, we have the other modules too, all your census information, clinical billing, EMAR, incidents, resident stuff, and services. And it's great because you can drive into these too and track see how many inquiries, tours, your ratios for closing and everything. Obviously, all this works really nice on a handheld device too. You can go in and manage your calendar or set up reminders or to-dos, or I like it because you can set it up where there's always a next action item. So your sales people always, have a next action item. Being in sales, you always want to make sure you have something scheduled to keep the process moving along. And you can manage, all this information from your pipeline and referral sources and add everything to your database from your cell phone. The assessment module is probably what we started with, and we started this almost 30 years ago. It was mostly a CRM and a clinical kind of a task manager system, and that's how we kind of built this very robust assessment module. So if you don't like our assessment in a box, you can customize it and put in any assessment. The assessment kind of tees up the service plan and builds the care plan. There's a wizard that takes from your questions, builds the care plan or service plan. Once you confirm services, that goes kind of into the billing logic. And there's a very robust back-end billing and methodology on how that all tallies the rent and services and any third-party ancillary charges, puts it all in a resident invoice. And we can also interact with the banks and our different financial packages. That's very nice. Whole thing's built to kind of reaching your financial goals. You can go into the system, put labor costs, put your census goals, and put your margins that you want to hit on services, and it'll tally everything. And you can run a report to show, whether you're making or losing money on each resident, and if you should kind of revisit your service model design. Real quickly, flying through the assessment, when you go into the module here, all the assessment questions are listed out. When you're done with it, you can pick that assessment, go down and create a service plan or a care plan super easily. It shows all the suggested services. You can just click on any of the suggested services that you want to do, and it builds that service plan for you. It'll put in kind of the who, what, when, where, if there's any recorded item, any instructions, or any specific facility instructions you can put in there, and these are all going to translate over into the handheld devices or to the task sheets when people are doing services. So it's very nice. Here's kind of, if you do have in your revenue and labor costs and margins you want to hit, you can get some great reporting on every resident because everything's kind of connected on the backside for you. So don't want to get too deep into service agreements, but well, hopefully they show up here eventually. The service agreements can all be sent out electronically. If there's people in different family members in different states or whatever, they can go and get that service agreement. There we go, slowly showing up. Too small to see, but that could be sent out. The electronic signing and everything goes back into the clinical piece and serves their gets set up there chronologically, so you can track all the different renditions and who signed it. Bear with me, my slides are going a little slow here. The full-blown electronic health record, and when you log in, you'll see here along the top, there's the main marketing tab, the clinical tab, and EMARS. So super easy to navigate. Then there's all the different modules. If you don't have that module, it'll be highlighted out. Down here, you'll see, this is accidentally when I took a screenshot, there's a wisdom to act, which is one of those intervention prompts where you want someone to interact with this. But while you're in the resident chart, you can go in all the resident charts. You'll see here, you'll have anything that's been attached to that resident has a little cloud icon. So you can attach documents to that resident. It shows their unit name. And then you can customize these depending on what your role is. If you're the nurse or activities director or whatever your role is, you can right click and add whatever fields you want. So when you log on, you have these customized landing screens, and then you'll have all these tops depending on what modules you have access to. In this demo, I have almost everything turned on, and I'll fly through them super quickly, but know that there's a spot for everything. And you don't need to use all these. The more information you put in, though, the better the dashboards will look when you run different reports. And obviously, our whole system is enterprise-driven, where multiple communities or homes, you can see all of them. You can break them into regions or groups, or obviously you can drive into one of them or benchmark them all against each other. So it's all built on an enterprise platform with security behind it, of course. So you have the demographic information, admit and discharge, unit history. This is where your billing would be driven from if you're using that part of it. The monthly charges are in here. You have all the contacts, medical professionals, health plans, church, temples, funeral arrangements, pharmacies, all their interests, diet, evacuation status codes, advance directives, notes, DME, all that is in here. And all this information flows to all the pertinent sheets. I'll show you later where it automatically creates that face sheet in different forms and Cardex if you're sending them off to the hospital. But all this information also shows up on the handheld devices. So if you do go into a resident's room and they're on the floor, you can touch on the picture of the resident and it'll show you the emergency contacts, their DNR, the status, all the pertinent information that you need to. All this information flows to all the different areas vertically and horizontally through all the modules. Their medications, allergies, diagnosis, immunization, TB status, orders. It'll show the orders, all the medications. You can obviously hide all the old inactive medications. It'll also show the origin of the medications, whether you pencil in. We do have a Metasprand drug library built into the system. So when you start typing, if you can't type the name of all the meds like myself, it starts filling them in for you. And it does the ICD-9 and 10 codes and fills them in for you. But everything is chronological. It'll also show you the delivery history, order history, and change history if you drive into the meds too. So instead of finger pointing with the pharmacy, wondering who did what changes, all that has a digital footprint now that you can track. So it's pretty nice. So you can see where those meds came from. The health monitoring, it tracks vitals, height, weight, meal intake, bowel movement, input, output, blood sugar, pulse, INR. We do have new temperature and other checks for COVID that we have built into it. These are older screenshots, so we don't have all the new COVID testing stuff that's built into it too. That's very nice. The assessments, every assessment gets stored chronologically, so you'll have all those. And what people do like about the assessments too is if you do a new assessment from an old assessment, you can cut and paste forward all the old answers. So it starts in a nice spot where it shows all the old answers, and you'll just show you the changes to the new ones. Services all get listed out here directly. The service plan agreement, it's not going to go too deep into that. The care plans are all listed out. You'll like kind of the problem, need, expected outcome. You'll have all the problem needs in drop-down list. Expected outcomes are all tied to it if you're using or set up in a box. The services and intervention and the services intervention kind of care plan reviews down below track everything. People like how easy it is to build a resident-centric care plan really quickly with the drop-downs. Notes go throughout the entire system. You'll like it because you can sort. Everything is built like Excel spreadsheets in the system where you type on the top, you can sort and look to see, different kinds of notes go throughout the entire system. Also, a leave of absence. If you click someone on a leave of absence, it tracks everything. It takes all their services off the schedules. It charts all their meds correctly. If you want to send them with a med list, you can do that too. It tracks, their hospital visit outcomes, leave notes, etc. is all tied together. The SBAR communication, if you do need to communicate with the doctors, this all fills out itself for you. It does a great SBAR communication form, gets filled out automatically. Some of the little stuff that I love about the system is you can customize the resident photo. There's 8 different icons that you can put whatever color and whatever designation you want on them. So when their icon pulls up when they're confirming services or looking at the EMAR, it'll show the resident with the icon on it. You can customize to about 18 different spots in the face sheet too that you can go in and put in. If there's anything really specific to your homes or communities that you want to track, you can build custom fields into the database too and build reports. You can build any report from the system, but there's a lot of stuff that's already hard-coded into it, like face sheets, Cardex, medication lists, progress notes, care plans, checkoff list, all that stuff is all hard-coded into it. You can also export anything. It all exports to Excel, or if you're want to go into pivot tables or BI tools, everything can be pushed out many different ways. Looking real quickly at our point of care, don't want to go too deep into it. It's super easy to use. You just log on to the point of care device. I pick up any device, log into your provider shift. It'll show you a list of all your residents that you have cares for, and click on any one of those residents very easily. It'll, the GoToMeeting stop recording. That's okay. you can click on any of the resident and it'll show, okay, there's blood sugar check for this person. It has a
You're still
default. We have
recording,
default.
you know, so don't worry.
Oh, good. Good. Thank you. The blood sugar, you can have whatever you want to be recorded, and that goes obviously right back to the health record. You can also, if you want to track true time in, time out that you spend as residents, you can move those up or back. But we have defaults built into there. Everything that obviously needs some kind of record will prompt them to record it, or it'll track why it wasn't recorded. If you hit that unscheduled unplanned services, it's going to give you a list of everything that you could possibly want to charge a la carte or above and beyond their plan of care or that they're paying for. And anytime you touch on a resident, all that information is kind of on a face sheet, from date of birth, allergies, diagnosis, diet, evacuation status, DME, notes, alerts, all that stuff shows up automatically with those residents and the icons that you have attached to them. I said before, you can do all this online or offline. It does, if you're offline and you're doing the services, it will prompt you to log in. So all that stuff looks good, and it'll tell you that you need to still confirm those services. So it kind of tracks that. And if you do want to go old school and still want to do paper checkoff lists, their service checkoff list, daily, weekly, and monthly checkoff lists. I touched on this a couple times, but our Wisdom to Act is that acronym for weight, intake, skin condition, difference, output, mobility, agitation, communication, tired, or weaknesses. I almost have that memorized. All these things, if you go into our handheld device and you're doing cares and you observe anything, you can go in, touch on a picture of the resident, hit the Wisdom to Act icon, touch on the resident, and say, hey, they were dragging their left foot. And then you can put that in. Now a pop-up reminder is going to go right to the nurse saying, Maggie was dragging her left foot, or Maxine hasn't had liquid in a few days. Whatever that alert is, it's going to pop up, and they're going to get an actionable alert where the nurse or caregiver has to do something. So very, very nice, easy to use, trackable, and you can use it for a whole bunch of stuff, and you can track a whole bunch of COVID requirements too with it that we've built into it. EMAR, I touched on it, but the workflow is the same that you guys are used to, so everyone gets worried that they think it's going to be different, but the med gets either e-prescribed or faxed to the pharmacy, goes in, they enter it in. As soon as it gets adjudicated and approved at the pharmacy, they send over the information to you that shows up on a laptop or a desktop or your handheld device at your side. You look through all the information, accept it. What's nice too is if anyone on your team can request a refill or reorder, but it goes into a different queue, and you can queue that up and order directly back to the interface. You don't have to fax anything back anymore. You can just request that refill and send it back to the pharmacy electronically now, I should say, with most of the pharmacies that we work with, a majority. But EMAR is super easy. That one part, instead of doing a month-end changeover that you have to do now, it's just a pending review, which is reviewing the EMAR, the inbox, which a med comes over. There's two meds that want to be reviewed. You look at them, make sure it's the right drug, dose, route, time. You can put in any scheduling details. Indicated for will come over from the pharmacy. If you want to set up any record items, blood pressure, pulse, respiratory, you can have those set up. The whole goal here is you just want to click this review complete button, and boom, that'll go from a 5 to a 4. And then when you're ready to do the med pass, you just click on the EMAR, picture of all the residents shows up, shows their unit, what's currently due, PRNs that resulted, missed or held, future meds down here, which you can't see. It'll show kind of a snapshot of what has been done, but it's super easy. You just click on any of the residents, all their medication, the image will come up, record status notes, previous pass. Obviously, if you're passing like a PRN or something that's only supposed to be given every 4 hours and it's 3 hours, it's going to flag that information for you, which is nice. PRNs, a lot of times it's going to make you obviously put some information and record. Obviously, if you do pass it as meds, it's putting your initials in here. When you do pass a med, it'll show that Greg passed that med at that time. PRNs, it'll show you what's waiting, what needs to be resulted, any recent PRNs. Missed or held meds will be shown here. And the allergies will obviously show up, and then all the resident information shows up in the last tab. And down here, you can kind of see that shift summary. People really like that, of what basically was given and happened, this shift summary. And then if there is a Wisdom to Act. You can access this through the point of care devices, or while you're on EMAR, you can always use the Wisdom to Act. But EMAR is super easy, and there's some cool reports that you can check all your PRNs, held meds, or holes in your MARS. You can run reports for whatever time frame, the last shift, last 24 hours, last month, and see if there's any possible med errors. You can also, it'll track any duplicates, and then here's where you can order back to the pharmacy when a refill request needs to be sent back to the pharmacy. So there's great reports. As those are internal med ports, there's a whole bunch of cool dashboard reports too that can show the live med pass and live services. Also a narcotic count that does some great stuff where there's second signature check boxes and validation, documentation, report logs, all kinds of great stuff if you need for the med. We also have it where you can, it shows you what it looks like on a laptop or a mobile device. So it looks good on those devices. So obviously tons of reports come from all this. Each one of the modules for marketing, clinical, and EMAR all have tons of reports. I'm not going to go through all of them because it's way too much, but there's from 24-hour reports, assessment reports, census in multiple different ways, medication reports. If you look down here, you can run service level variance reports to see how many each services, each resident, and each provider is providing. So it's really great information. And then a lot of financial from accounts receivable, kind of a month-end debit, credit report, all kinds of reports, rent rolls, everything that you could possibly think of in the reporting modules. On the EMAR, there's some great reports too, kind of ball movement, 24-hour reports, meal consumption, and people love the shift validation report just to see exactly what happened on any given shift. You can go run those reports for different times. And other, lot more forms that are too much to talk about, but it has every form. Obviously, we can do custom forms too, but in our kind of setup in a box, we like to try to stay in the forms that are built into the system. So with all that information, our dashboards actually have over 280 widgets. When you log onto them, it shows you everything. So all that information, however diligent you are putting information into the Eldermark database, you get these great dashboards. So there's KPIs on everything that you could possibly think of, and you can drive down, you can build custom reports. So if it's a management report or an ownership group wants to see these certain KPIs, you can build custom reports and share them with people. And I tell this is the laziest way to do it is you can set up push reports. Say that someone doesn't want to learn how to use Eldermark, or you can use the dashboards. You can set up reports with whatever KPIs they want to track, have them set up at whatever intervals. Say Friday morning at 5 in the morning, they'll have all the KPIs that they want to see built in a report and have it sent out at different intervals for them. But the dashboards are great because you can log in from anywhere, anytime, and see all the information. End of shift dashboard is one that people absolutely love. Shift status, so you can watch the actual, every one of your shifts in the status, how many scheduled things I have, how many remaining missed PRNs. There's also, this will show if there's unplanned, unscheduled services that were confirmed. That could be potential extra revenue too. Incident lists, alerts, your QA, QI is done with the risk management report. People absolutely love it. You got that, the risk management button. If you do click that, it keys up a new report for you. It'll ask you for a new incident or accident report. It'll start that. It's really nice because it does make you fill out everything. So it won't let you leave stuff blank. And obviously, if anyone makes changes, only the highest level of people can make changes to it, and every change that made is notated. Bear with me for 1 second. We're slowly going. So when you do start a new incident or accident, they all get charted here. It'll show you the report. You can chart, who, what happened, describe what you saw, were there witnesses. You can chart directly in the body, report to it, ask for notifications and signatures, all the standard stuff. Ask for contributing factors, environmental factors, residential factor, all the pertinent information gets charted in there, and if anyone does make changes, it tracks who makes those changes. Here's where you set up those distribution lists of who you want to be contacted if there is an incident or accident, a distribution list so people can get those. And if it hasn't been taken care of in whatever time frame you allot, it'll send you another thing saying, hey, this report hasn't been closed out. There's also medication incidents, very similar to the incident accident reports, that all get sent in there and logged in. You can obviously do query and do root cause analysis of all that information because it's not just in paper reports. I'm not going to talk too much of billing. It's pretty easy. You set up all your chart of accounts, basically your revenue accounts, and at the end you can generate statements depending on your methodology of how you guys bill. It does a batch. It can push out to most general ledgers. We have direct interfaces with quite a few, and like for little ones like QuickBooks and stuff, you can just create an IFF file, upload that month-end batch, and send it directly to QuickBooks. And it does really nice statements. There's tons of ways to customize them depending how much information you want listed out on those statements. Our cloud storage scanning capability is pretty easy. It's basically a HIPAA compliant Dropbox. You can send any document, whether it's sent to your phone or your computer, you can upload it, or if you have a scanning agent on your fax or scanner, you just scan that and store it right into electronic health record, and your e-signature is super easy to use too. The number one thing that's really hot right now is our notify nurse call and communication. I don't want to get too much into this because this is an additional, this is a nurse call system where you buy and you own it. We also have a communication app that is a monthly fee, but you can communicate between the care providers, the residents, and engage their family, let them all talk back and forth, and you manage the whole system. So if you take anything, if the system's not for you, I really think this next screen, this shows what the screen looks like if you're using our nurse call. If a polar pendant goes off, we're different than most other nurse calls. That goes directly to a pager. Ours usually go to an iPhone. It can show the location of the workers and the residents, so the closest person can take it, and then it'll show who took it, and then most importantly, it tracks how long it took them to take it, what was the response time when they reset the polar pendant. And if they did anything, they can chart directly and note that it's a billable service. Well, that's great on Notify. We can, but with the caregiver, with our caregiver app here, most of those calls aren't real emergencies. You know, we're seeing the intake probably up 30-40% right now just because people are lonely. You know, and most of the calls are because they want a blanket or to talk to someone, not for emergency. So now we can call, the caregiver can call right back and see if it's a real emergency. And we're finding out that the average time, we've done time studies, is about 5 minutes on each one of these calls. Well, if you're using this app, we've got it down to about 2 minutes. It's a huge saving. It's about $4 of savings. Times it by how many calls you have, it's saving people, you know, hundreds and larger communities, thousands of dollars, just cutting down on that time for that communication. So if you're further interested in Notify, it's notifync.com, and there's tons of great videos and information on our website for that. In regulatory, of course, all of our stuff, we have a lot of state forms in different states built directly, and in most of our forms comply to all the state regulations. Not going to get too much into kind of how Eldermark runs your business, but as you can see, all these modules are all tied together. You know, you put in what you want to do, identify your goals, what your revenue, your labor costs, and we can build a service model design and help you track all that to actually run your business. Don't want to go too deep into all that. We do have great people that can help with that service model design too. Some of that may be outside the scope of kind of our small business solution here, but note that we do have obviously the small business, and we have additional modules if you want to look at a larger enterprise system. Number one thing that people love about us is kind of the way we get people started. When you get started, you get an account manager and a nurse trainer. All of our trainers are nurses, and when you get going with us, we have, you know, our customer support is 24/7. We have support centers in Jamestown, Fargo, in Bismarck, North Dakota, way up north. So they're frozen in most of the time. No, but they do a great job, and you build a personal relationship. They help set up your database, they help you maintain it, and you have an account manager and a nurse that you can call, a nurse in the cloud, if you will, 24/7. So people really like the fact they get a live person in the States that they can talk to at any time. We're adjustable because it's a brand new model. Kind of the original model we came up with was for up to 10 units. It's about $250 per month, and for 10 to 20 units. If you're part of the association and on Molly's team here, I don't mind doing, the lowest we can go for a contract is the $200, and we're flexible, on units. How we do units, obviously we say you have, 10 beds, you may have, doubles in there and get up to 12, or you may only have 8 people. We pick a number that's fair. And if you have multiple buildings or communities, we can work with you on the numbers too. So we are flexible. It's kind of a case by case unit. Our typical what we get on the open market for our product for enterprise for large facilities usually ends up being about $5,000 upfront fees and $10 to $15 a month per person. So this is in alignment with that, but you're getting an enterprise, large system for a smaller number. One-time training and setup fees for this program, we figured it's going to be about $1,200, and we wanted to get $100 a month plus $300. I don't mind waiving the $300 and just doing $100 a month or $1,200 over the first 12 months, so an additional $100. So you're getting $5,000 of training for $1,200. So great value. Just our CRM alone, if it's standalone, we charge $125. So you're getting $125 a month CRM with unlimited users and all the other modules. If you reverse engineer it by how many residents you have, and we can make it very cost effective. And if you have multiple communities, we can play with those numbers too. So with that being said, I try to keep it under 40 minutes. I was almost there, Molly, but
You did great.
And I didn't even look at the questions or chat. So hopefully there's some good questions if you could stop me out there.
There is. All right. So the first question we have is units beds or units houses? It sounds like you said units was beds.
Yes, well, either or. Everyone, they may be licensed for 16 units, but they run typically at 12. Well, we can do it at 12. Yeah. So we're flexible with that.
Okay. And then the next question we have, it says, does Eldermark have timestamp capabilities, especially for offsite service recipients?
It does.
Okay. And for billing, which presenter describe as being like QuickBooks? Are we able to record business expenses or just revenues?
Just revenue. We do have a financial product if you want to go into a bigger enterprise solution that does that whole GL piece. But most of the time we just deal in the revenue buckets, do a month-end close and push that off. So just accounts receivable and revenue.
Okay. The next question, what is the cost if you have more than 20 units, which could be just 2 houses, like 2 10-bed homes?
I mean, you can average $10 per resident. That's kind of our standard pricing, $10 per resident per month.
Perfect. Can we do device management? So caregivers given a mobile phone from the RAL home so that HIPAA data is only accessible from that device.
Correct. You can lock them down. Yeah. You can be a big brother. We have ways to show you how to do that, of course. And they all have some internal things built into it so you can track them and shut them down too.
And it sounds like there's some training that comes with this. When they purchase the program, they can call a customer service line to train their manager.
You are correct. And we have everything. We have videos on every piece of it, extensive videos and resources, but they do get personal training too, especially for the EMAR piece. When they go live, we really hold your hand and walk you through that, because once you go live, it's easy, but that initial dump, the hardest part of the whole program and the EMAR side is, say that you do have 10 residents, they each have 10 meds, they throw 100 meds into your system. We help you walk through those the first time, because that's the only daunting thing.
Yeah, I can imagine. Next question, are food menus tied into Allergies?
We have a separate program that I didn't show a slide for that we do have that. That is not included in this program, but we do have that available. You'll have to contact me personally.
Yeah. So this question says, he said $10 per bed per person. If I have 16 units, that comes to $160, but the pricing says $345.
Well, the answer is yes. We're flexible depending. Our goal is we want between 0 and 10 to 20. We want our minimum contract's 200. So that's where it's really not fair for the small guide, but the more billings you have, the better it is. But I promise you, just with not printing paper, storing paper, destroying paper, being more compliant, being faster, the ROI, I'll show you ways to make that $200 10 times over.
I figured.
But
You
we do
guys
have
have so much information. That's been a lot of the comments that we have so far is this is so much information. So I love it. You guys, I'm sure, have an answer for everything. I'll move on to the next question. If a residential assisted living house has this software, it could be a selling point, obviously. So do you have a nice video that they can show to prospective residents and their families? Or is this something already on your website?
No, we have a video and we have a whole bunch of co-branded marketing stuff where you can stick your logo on it. And yes, just the fact that the family wants to know that they can engage and check it on their loved ones. So yes, we have great marketing collateral for you.
That's great. Next person, we're still in the process of buying our first residential home. Will you still honor the pricing discounts when they're ready?
Sure, yes.
Perfect.
We also, one thing is nice too, if you are building a house, and we do this all the time where, today there's a new 100-bed in Chicago, and obviously they're not going to pay, $13 or they're not going to pay $1,300 when they just opened up. So we usually scale it over a year, sometimes even a year and a half. So we'll do, 200 the first month, 400, 600, 800, just because we give them time to fill up. And we'll do that too, even on a small community. And that's where I can differ a little bit from that $200 to $250 fee. I can, if you have a brand new one and you're just opening, I can work with you and maybe give you a couple 3 months up front or scale it over a 6-month period to let you fill up with all your residents.
All right. The next question is, have you seen insurance companies give discounts as long as they have the Eldermark software implemented?
Yes, but I don't know. I mean, 10 to 20%, there's a handful of them in Minnesota and Wisconsin that are doing that because we went to them and said, hey, this is a great thing. But, in my eyes, the insurance companies usually, hopefully there's no insurance agents on the phone, but I feel like they usually jack your premiums up by, 20%, then they'll give you a 20% discount. So yeah. I don't know. I haven't seen it be huge, but yes, I think you should go and say, hey, the biggest thing people get sued for is incident and accident and med management. Those are the two things. So you would think if we're tracking all those and monitoring them all 24/7 with technology, that you would get a discount. But I have the proof in white papers that if you want to go sell your insurance agent, maybe we can send them some business too.
Is there a way for you to make your contact information bigger on here? I will, just so everybody knows, I will be sending all of this information, the recording, everything tomorrow. So you will get all of this information tomorrow. If you want to contact Greg, his information is at the bottom of this slide. It's a little bit light. It's in white writing. Yeah,
I apologize. Yes, it's super Greg, Greg at Eldermark.com, or you can go to sales@Eldermark.com, and there's different sales reps in different areas. So whoever you get, obviously you can reach out to me directly. I'd love to talk to you, and I can point you if you're in, Florida or Arizona. We have different people in different areas. So, but I'll definitely point you in the right direction. But just Greg at Eldermark.com or sales@Eldermark.com.
Perfect. Everyone keeps asking, can you send me your slides?
Sure. Yeah.
Okay.
If you want to send out, I sent you the slide deck, Molly. So if you want to send that out, feel free. Okay. I can send whatever slides you'd like.
Okay. Perfect. All right. Someone asked, could you talk about the difference between this product compared to products from Caremerge and AL Wizard or RealPage?
Yeah, well, I don't know. They're all a little different. RealPage is more financial. Caremerge is a great little product that is a great family engagement, but it's not a full-blown electronic health record, and they will never connect into into a true-blown health information exchange, which we are. I'm not getting into because we're in the small business piece, but we are connected into the big hospital system, so we can connect into health information exchange, which, at some point these MCOs and ACOs are going to manage care organizations are going to make sure you're part of a group, and they're not going to refer you business unless you're part of that. So there's a bigger picture happening in the background, and that's where Caremerge is a great it's a pretty program. And then the last one was Alice or AL Wizard. Yeah, and they're almost all of our competitor. I mean, they're a decent. They're not a full. I mean, they have a handful of modules. They just don't have all the modules that we do. But most of our competitors, came from the skilled nursing where they're, MDS billing driven, and we're tracking the lowest person on the org chart and tracking the services to give better cares, which make nursing time more efficient, which kind of, make your ROI better. So we're really different. The fact that we can, configure so many different ways. So for some people, those little products, if, Caremerge is a great little product engagement as far as it's great for the family member, but it's not a full-blown electronic health record and can't be configured the way our system can.
Okay, so next set of questions. Suppose the pharmacy uses another system. Please advise a list of systems that Eldermark can interface with, if any, in times of document sharing.
Well, we have 25 to 28 pharmacy backends. So you've got if it's a long-term care pharmacy, even a retail pharmacy, we can interface with almost every one of them. But it does have the Metaspan drug library built into it. So if a resident does come in with their bag of, meds from Target, you can just start typing and it all fills in there for it. So we can interface. And if even pharmacies that don't have any technology background, if a lot of them are willing to key those meds in and send them over that way. They can key them in, profile and send them over just to earn your business. So there's a couple options if your pharmacy doesn't play ball.
Okay, can you give a sense of how many support recipients and staff users that Eldermark for small or large agencies can support?
So one more time,
He says, can you give a sense of how many support recipients and staff users that Eldermark for small or large agencies can support?
I mean, we have a lot of people up there, and it goes, when you type in support, it goes to, I don't know, 50, 60 people's emails and pops up on their thing. So someone gets back to you pretty quick at night. There's only a handful of people on the overnight, and we do have an overflow call center that takes those. I don't know, we've never had problems with support. That's one thing, because it's a brand new program, we're trying to limit the support for the small business to kind of emergency stuff at one tier and 9 to 5 stuff at a different tier. And that is the difference if you saw the contract between the small business solution and our main contract. Our main contract is 24/7. All the time. The small business, we're going to try to, if it's emergency, we can get all, if your system goes, and we're up 99.9, and we probably went down for 2 hours all last year. So our uptime is pretty incredible.
Yeah, that sounds like good customer service right there. Let's see, is there a cloud type backup for the data for on-site backup?
Yep, everything's backed up in 3 different cloud locations. So we have it all mirrored and backed up in different locations.
Okay.
So it is, and we have that backup every night. We back up on your local drive the pertinent information that you would need in case you lose power or lose connectivity. We back up the pertinent things that you need to run every day on your own drive.
And if someone is already using a different software, is it easy for them to interface with your system and integrate what they have as information into Eldermark's system?
We have a great import tool. It depends what system it is. Some are friendly and some are not. So if they'll export everything to XLS or a format that we can take in, we have an import template. I really like, it's a smaller community. It only takes so much time to enter in a resident. That's how you learn. So, I mean, yes, we can cheat and import everything very fast, but I like going through the process of putting people in because that's how I learn. But yes, we do have import tools that you can import everything easily.
All right, last question I have on here so far says, does Eldermark have enough market share so that experienced caregivers and managers may already be somewhat familiar with the program?
Yes, in Minnesota, we're about 80 to 90%. We have about 500 communities in Minnesota. With that being said, different areas. Yes, like when people advertise in Minnesota, they say must have Eldermark, experience to work here. So
Great.
It's different. So yes, in different areas, but most people, it's very user friendly, and we have to make that because we know people turn over. We do usually tape, and we have all the training sessions taped. So if people do want to come in and retrain, and we have some, like for EMAR, there's 23 lessons they sit and watch 2 to 8 minute YouTube videos. They take a little driver's license test and they test out. So you can, in an hour and a half to 2.5 hours, you can test out your med techs and aides to make sure they know what's going on.
Well, that's great. Well, guys, that was a lot of questions. I don't have any more questions so far. If anyone wants to pop in the next few minutes, that was a lot of information, Greg. You guys have so many different programs and products for sure. I don't think I even realized until I saw this presentation from you.
Yeah, and we get that all the time. I tell people I could talk like an hour on each module. So, but no one wants an 18-hour demo. No one's ever taken me up on it. So, and I'm far. If people do have really deep questions on like sliding insulin scales and different things like that, I'm kind of a partner at the company, but I'm a general practitioner, if you will. I know a lot about each module, but I'm not a master of any of them. So we do have our nurses are better if you want that clinical. We have 3 full-time CRM specialists that work for large sales and marketing people for large organizations on the West Coast. You'd probably know their names, but they all ran big regions and they train our CRM, and we have great billing specialists. So there's kind of 3 groups that you get to know during your onboarding process.
So they're going to teach you how to market too. That sounds like what you're saying right there.
Well, that's the next seminar I'm doing for you, the digital ad agency. Yes, we have a marketing automation platform, a digital ad agency, but I don't even want to get in. If you need to fill your community, I can help you with that too. But that's a different topic. Unless someone wants to stay on for another hour, I'm up for it.
I can only imagine this would be like 5 hours of more information if we just asked about each slide. So 2 more questions just popped in. Is Eldermark able to restrict support recipients' data view to specific staff users only on a need basis?
You can set up security groups with whatever restricted use you want. I think that's kind of what they're asking. Or we have stuff if the state comes in and just you don't want to give them. The beautiful thing about this is if you do, the state comes in and they ask for these residents, EMARS, instead of giving them everything to possibly find something, you can run a pre-report for these residents for this time period and make sure that everything looks beautiful before you print that report. So
that's great.
Yeah.
Okay, last question on here. I'm sorry, not last question. Somebody popped in. Another question on here. What is the average time to train for this system when starting from scratch?
I would say a month. I mean, the fastest, you could do it in a couple of weeks if you want, but not if you have a community that's up and running, especially in this state. in today's time, it may take a little longer. Probably average 4 to 6. The trainers would say 6 weeks. The sales guys would say a month.
Okay. Yeah. If we use your system, can we go paperless and maintain compliance at the same time?
Yeah, it depends what state you're in. So most states, there's a couple docs that still have to be, but in this, I think they're getting very lax on what you really need to sign in person because they don't want people signing in person. So I hope is yes, but it depends what state you're in. So there's a couple states like I know Virginia still needs that like 2 documents, but we went from instead of having a huge folder on someone with just down to 2 pieces of paper. And we've done all kinds of studies on a 60-bed community, which is kind of our traditional sweet spot, if you will. They end up spending about $400 to $420 a month on printing, paper, copiers, storing, destroying, all that. And at $10 a resident, it's a wash, and you get to go completely paperless. And you don't have to have, most of these places have a couple of units filled up with, storage stuff, or instead of more space that they could be using for better things.
Absolutely. So specifically, do you know if they could go fully paperless in California?
You could get very close. Okay. I'm not a California specialist. I don't want to say yes from a compliance, but I think you could get very close. I don't think there's anything that if you scan and have that document in the record, I think you could go paperless.
Okay. Well, perfect. If no one else, it looks like quite a few people have signed out already. So I think we're done with questions. My next webinar is Monday, which is the 18th at 3 p.m. So a different time with Eden Alternative. We're going to talk about creating home within your facility. So everyone have a wonderful evening. Thank you so much, Greg. This was very informative and really great. So I hope that everyone, if you have additional questions, just reach out to Greg or reach out to his team, and I'm sure they can walk you through everything through a demo.
Great. Thanks, Molly. I appreciate it. This is great.
Thank you.
Good night, everyone. Bye now.